The other issues that we discussed were Rio, and mainly our lack of understanding on how Rio actually works and what it can do for us, and the inefficient use of its potential. So we kidnapped, for want of a better word, Roger Smith and had a question and answer session with him, and it was amazing that we learned what we can't do, what we can't expect, but what we can expect and what we can get. So the other thing that we were looking at was manual spreadsheets are still being used a lot in admin, and they are hated. So having spoken to Roger and to Stella, I can't think of her name, Stella Randall, we've discovered that we can pull a lot of the information that we're storing on spreadsheets from Rio and Tableau, and we can have that information. So our solutions are to look to improve our knowledge of our systems by going on training if it's required and getting the experts in to talk to us, to utilise our experts to the best of our ability, so we will see you again. And we're going to, as an admin group, going to start to attend the user record group, which is something that we've never been involved in before. And we're also going to look at the effective use of Tableau. Some of the other issues that we discovered were equipment and its uses, really. So the issues were inconsistencies with telephony. Different areas use different systems. You've got Daisy, you've got BT, and it depends if you're in a Southern Health unit or whether you're in a GP surgery or such like. Our systems don't talk to each other. So if we get a phone call to say that we're short of admin in Fareham, they can't transfer their calls to Havant for us to take them. We actually have to send an individual away from their base over to Fareham to do that work, and it's costly, it's just not effective at all. So we're going to speak to the people that are in the know, and we're going to get them to look at the systems and if there's anything we can do to make this transition smoother. As mentioned earlier, it's the multiple equipment provision. The nurses are carrying heavy bags, they've got laptops, they've got phones, they've got cameras, and there's going to be some work done to get them a smartphone of some description to try and ease that as well. And one of the biggest things is the office environment and the locations that admin are quite often put in. So as an example, we're in a doctor's surgery. We have a photocopier which isn't fit for the amount of people that use it. It's a very small thing. Therefore, doing a project or printing off takes twice as long as it should do on a better sized piece of equipment. But the biggest problem is it's in an office where we've got 4 admin trying to take phone calls from patients. So in the background, you've got the constant noise of a photocopier. And it isn't easy because information can get missed. If the patients are quite often hard of hearing if they phone into us, and you're having to shout over a photocopier as well. And it's just not a suitable working environment for admin or for the patient to receive that service. So our solutions, again, are to make contact with the experts, to explore smartphone use in more detail, and to do an inventory of the current state of equipment that is used across the whole of the admin division. I was doing so well. And we're going to see whether maybe our photocopier might not be good for us, but it might suit one of the other locations better, and then we invest in something new. And the last one are the communication issues. As an ICT coordinator, I have to liaise with our local hospitals, and I have to track patients' admissions and discharges, and our communication systems don't talk with theirs. So we might have a patient on the visit list. That morning, I can't actually find out whether they've gone into QA. Tableau is 24 hours behind. The alerts that come out of our PHTs can be up to 4 days behind, and we're quite often turning up on a patient's doorstep to do a visit, and they've been admitted to hospital overnight, and if they have no family to let us know, we turn up and we can't stop those wasted visits. So we're looking at getting more information to see if we can pull that from Tableau quicker, especially when people pass away. If they pass away in QA or in any of our other hospitals, we aren't told in a timely fashion, and we can turn up on a doorstep. And it isn't good. So we're looking to work with Tableau to see if we can pull that information from the hospitals sooner to improve. We used to have a system called Oceano, which was a live feed to one of our local hospitals. That we don't have access to that anymore. So therefore we're now not seeing anything live, and it needs to improve for us to do our job. as I said, that is the reason for the unachieved visits. Clinical correspondence is something we struggle with massively. We will make a referral as a service to a consultant, and we will explain to him that we've got an 86-year-old lady who needs some support and give him the background. When he dictates his letter back to us, he will dictate that she's an 86-year-old lady living alone, which we already know. So we end up having to dictate and type up exactly what we sent in the first place. So we're looking, as a solution to that, to get a standardised letter that has bullet points in it for the actions that they want us to do, rather than us read exactly what it is that we sent them in the first place. And we think that would massively reduce waste of time and money and energy. So the solutions, again, are to utilise our experts, to use our patient messaging service that is available through Rio. So some of those patients that might get admitted might not be able to tell us, but they could text us and tell us that they're there. Equally, we would be able to reassure patients by saying, you have a visit today, please don't go out, even though you're housebound. Please do not do that. The use of Dragon, the voice recognition service, for the clinicians to be able to use this to make it easier for our staff to dictate the letters, transcribe the letters that come through to us. And again, to standardise the letter format that we use currently and to remove the waffle.
So our proposed future state will be a single point of contact for all professional referrers and for ongoing care. So it won't just be for new referrals as it is currently. We'll have a consistent method of contact for referrers, so we'll close down all these alternative routes that are happening at the moment, and a change of culture for everybody, so it's to enable staff to feel equal and empowered, and ultimately we'll have the right people doing the right job, so our admin staff will be doing our admin jobs. So we've got an outline of our implementation plan. It's very long, so we haven't sort of gone through it bullet point by bullet point. But we have all made a commitment to a 30, 60, 90-day plan for each of our points. And then we've got the benefits of our changes. So we found, as the benefits, they mostly fit into 4 key areas, although there is a lot of crossover that's happening. But so one of the key things will be time. We'll have reduced time of processes by understanding Rio better, and by understanding the search facility better. A clarity of roles and responsibilities, reducing duplication and confusion, reduced time duplicating on spreadsheets which are already available for analysis, and then a big benefit will be safety for our patients, putting our patients first and getting accurate information and getting it right the first time, a standardisation which will create continuity and consistency, and again it has that potential for crossover with our staff so that we're not travelling to sites where we could just be popping our phones through. More concise letter information, which is easier to read, and getting the right information for our patients so that follow-up isn't missed. And then quality, just having the experts in the room leading the change, and understanding the processes, and a lot of knowledge sharing. And obviously one of the main benefits for us as admin staff as well will be well-being. So have a sense of team bonding, potentially opportunities to network during the week, and plans to continue afterwards to maintain and improve, and just having respect, mutual professional respect for each other. And then just at the bottom there as well, we've done an example of how just a sort of tiny change could actually be quite a massive saving in cost.
And just to finish off, when we started the process, we discussed kind of our own expectations and any concerns we might have with this process. And a lot of the consensus was the ability to kind of follow that through and not just stop it this week, and ensure we continued that process, that we continue to embed the processes with the other admin staff that haven't joined in this week. The empowerment of staff to make sure that, again, it doesn't stop here, that we continue to question why and question our processes, that we don't forget the small things such as scanners and photocopiers, and the importance of patient involvement and voice. So we were lucky enough to have Georgette Holbrook join us. She couldn't join us today because she was up till 3 AM counting votes, bless her, but she has left us some comments here, and she was completely valuable to all of our discussions. She made us question it from a patient's point of view. She has expressed that if we do something similar for our mental health admin, that she would be willing to join in with the week. And she reiterated to us not to forget her in our 30, 60, 90-day action plan. So she was really pivotal for all of us really during this whole week. And just Sarah McLaughlin, who is our process owner again, who couldn't be here today, just a quote from her for the week. And lastly, just some thank yous. So just to reiterate, our technology input from Stella and Roger for us, even just the hour question and answer session we had with Roger, we learnt so much. So that will definitely come away from us. A thank you to the transformation team as a whole, as I know Dean and Amanda, you were certainly pivotal in getting a project within Portsmouth and South East Hampshire admin for us. Gosport 1 and 2, who were the host for our observations, and again, similar to the previous team, our wider Portsmouth and South East Hampshire admin that have continued business as usual and allowed us to attend this week. So I'm just going to hand over to Nikki Adamson-Young. I thought I saw her coming. Yeah, brilliant. Who's been our sponsor for the week.